In Taraba State, Governor Agbu Kefas has directed the state ministries of Information, Agriculture and Health to embark on sensitization of residents on the dangers of anthrax disease. Health personnel have been deployed to Cameroon border communities to vaccinate and check those cattle moving into the country. Correspondent Owolabi Adenusi filed in this report.
Taraba is known as the largest animal husbandry center in the country. The state, which shares borders with Cameroon Republic, has one of the nation's busiest cattle routes, through which an estimated 5 million cattle pass to other parts of the country monthly. It is why the recent discovery of a case of anthrax in Niger State by the Federal Ministry of Agriculture and Rural Development has Governor Agbu Kefas really worried, considering the number of cattle that moves across the state daily. The governor has now directed the State Ministry of Information and Reorientation to create more awareness on the dangers of the disease through the media.
The reason for this gathering today is to let the Taraba people know, or let them be aware of the outbreak of the anthrax bacteria.
He also wants health and veterinary personnel deployed to Cameroonian border communities. This is already a work in progress, with the State Director of Veterinary Services, Dr. Shehu Abdullahi, confirming that his personnel are out across the 16 local governments of the state, vaccinating cattle and checking livestock coming into the country through the Cameroonian borders.
And we have few of the local governments that is bordering some some countries.
When TVC News crew visited abattoirs in Jalingo, the health personnel met on ground spoke on hygienic processing that has been put in place to avoid zoonotic diseases.
All animals that have been slaughtered, we have to survive it before we reach to main market.
Health workers in Taraba State have been charged to be on red alert at all times by checking thoroughly patients that come up with symptoms of the disease.
Outbreak that we are having now, the healthcare workers have to be sensitized so that they will be on the watch out, especially for those people that are working with these animals.
Anthrax is a serious infectious disease caused by a gram-positive bacteria known as malicious anthraces. It occurs naturally in soil and commonly affects domestic and wild animals around the world. Nigeria had its first index case in a farm at Niger State, where some of the animals had symptoms including oozing of blood from their body openings, anus, nose, eyes and ears.